So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is the correct, and after, let's discuss this test step by step. So it's 65-year-old man. His major complaints is fatigue, pale skin, and unintentional weight loss over the past 6 months. And also, he has recurrent pneumonia and sinusitis. The first feature we are looking at is age, because some disorders affects mostly adults and some disorders affects both children and adults. For example, in hematology, we have a diagnosis acute leukemia. Acute lymphoblastic leukemia affects both children and adults. In contrast to this, acute myeloid leukemia mostly affects people older than 50. So, if you see that child has acute leukemia, you can straight away guess that it's acute lymphoblastic leukemia. Also, we know that autoimmune disorders affects mostly young people, and disorders as chronic lymphocytic leukemia or multiple myeloma affects mostly old people. So, age of patient sometimes can be very useful. Fatigue and pale skin are classic anemic symptoms. Unintentional weight loss over the past 6 months most probably tell us about oncology, and recurrent respiratory infections are a sign of immune deficiency. On physical examination, patient has generalized lymphadenopathy and hepatosplenomegaly, which are very important diagnostic features. His hemoglobin is 71, which is low. Decrease in hemoglobin we call anemia. Anemia explains his complaints on pale skin and fatigue, and we know that anemia classified based on severity and the size of red blood cells. To determine severity of anemia, we have to know two numbers, it's 110 and 80. Also in this case, it's a man, and the lower limit of normal of hemoglobin in man is 130. So from 130 to 110 is mild anemia, from 110 to 80 moderate, and lower than 80 is severe. In this case, hemoglobin is 71, so it's severe anemia. The type of anemia we determined by the size of red blood cells, and to determine the size of red blood cells, we have to look at MCV. In case of MCV, we have to know two numbers, it's 100 and 80. Everything above 100 is macrocytic, between 100 and 80 normocytic, and lower than 80 is microcytic. In this case, MCV is 97, which is normocytic anemia, and as we see, red blood cells are also low. So, in this case, patient has severe normocytic anemia. Platelet count is 110, which is low. And to determine the severity of thrombocytopenia, we have to know two numbers, it's 100 and 50. The lower limit of normal for platelets is 150, so from 150 to 100 is mild, from 100 to 50 moderate, and lower than 50 is severe. In this case, platelet count is 110, so it's mild thrombocytopenia. In addition to this, we see elevated white blood cell count. Leukocytes are 41, which is very high. And we know that white blood cells consist of three types of cells. It's blood cells, lymphocytes, and myelocytes, and the most abundant myelocytes are neutrophils. In this case, blood cells are absent, lymphocytes are extremely high, and neutrophils are low. So, leukocytosis is caused by increase in lymphocytes, and increase in lymphocytes with increase in white blood cells we call absolute lymphocytosis, which is a diagnostic criteria for CLL. And as we look back, in addition to blood analysis, there are important diagnostic features of CLL. First of all, it's generalized lymphadenopathy, hepatomegaly, and splenomegaly. It's immune deficiency due to the inability to produce normal antibodies, it's weight loss, and also he is 65. and we know that CLL mostly affects old people. His anemia can be explained by development of autoimmune hemolytic anemia as a complication of CLL, and thrombocytopenia could develop due to the immune thrombocytopenic purpura, which is also a common complication of CLL. The best next step in CLL is to verify diagnosis by flow cytometry, which determines CD receptors on the surface of lymphocytes, as CD19 or CD20. JAK2 mutation we determine in case where we suspect polycythemia or primary myelofibrosis. Epstein-Barr virus we determine when we suspect infectious mononucleosis. Serum protein electrophoresis we use if we suspect multiple myeloma, and lymph nodes biopsy we use to verify lymphoma. In differential diagnosis, the only pathology which can cause generalized lymphadenopathy and hepatosplenomegaly is lymphoma. But lymphoma grows in tissues, not in blood. Thereby, they do not cause increase in white blood cell count. Leukocytes in lymphoma will be within normal margins, 7 for example,